Tonight, as the World Health Organization says coronavirus is now officially a pandemic, we'll show you how quickly this is spreading and why critics are saying the administration's sluggish response has helped fuel the spread. Then, if you violate a quarantine, should you get arrested? Our legal panel joins us to discuss that, the Harvey Weinstein sentence that came down today, and more. And another big win for Joe Biden. He takes 4 primaries last night and extends his lead over Bernie Sanders. Is Biden now inevitable, or does Sanders still have a chance? Good evening, everyone, and welcome to RFL. I'm Richard French. More than 1,100 people in the U.S. have now tested positive for the coronavirus, and 33 people have died. Plus, the numbers, they are spiking in New York and New Jersey and beyond. New York now has more than 200 cases. Jersey announcing 8 new people testing positive today, bringing its total to 23, and now more and more events being canceled or postponed as those numbers continue to grow. As the spread of the coronavirus accelerates around the world, today, the World Health Organization declaring this is now a pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
More than 120,000 people have contracted this virus worldwide. In Italy, more than 2,000 new cases confirmed overnight, including 200 new deaths. And in Iran, the semi-official Fars news agency says 24 government leaders have contracted the virus, including the country's vice president. Here at home, senior Trump officials blaming China for a slow global response.
It probably cost the world community 2 months to respond, and those 2 months, if we'd had those, I think we could have dramatically curtailed what happened both in China and what's now happening across the world.
In the United States, concerns of the spreading virus leading to a wave of cancellations. The NCAA announcing it will play all March Madness games in front of empty arenas with no fans in attendance. Major universities like Ohio State and UCLA, and in New York, the state and city university systems are scrapping in-person classes. San Francisco banning public gatherings of more than 1,000 people, meaning the Golden State Warriors won't have the fans in the seats. 3 counties in Washington state setting an even stricter limit at 250 people. Plus, New York and Chicago are the latest major cities to cancel their St. Patrick's Day parades.
We would recommend that there not be large crowds. If that means not having any people in the audience when the NBA plays, so be it.
Fauci also saying that the coronavirus is 10 times more deadly than the seasonal flu. And Dr. Fauci also said this.
I can say we will see more cases and things will get worse than they are right now. How much worse we'll get will depend on our ability to do 2 things: to contain the influx of people who are infected coming from the outside, and the ability to contain and mitigate within our own country. Bottom line, it's going to get worse.
And if you want an idea how worse, you don't need to look to Wuhan, China, or to Asia. Look to our friends in Europe. Today, Angela Merkel, the German Prime Minister, said they have certain modeling that says 60 to 70% of Germans could be infected by that. And in Italy, just now, as they have a system and a medical system overwhelmed with this virus and positive tests, as well as fatalities and growing numbers at that, they have now shut down the entire country. And when I say shut down, with the exception of a supermarket or a pharmacy, everything else in the entire nation of Italy is now shuttered. Think about that. Could that be our near future? Now, we are also learning much more about delays in testing, which is a huge part of knowing the size of the problem we're dealing with, where the problem exists, and then obviously having the capacity to immediately address it. The lack of testing, lack of kits is making things much worse, despite our president's assurances otherwise.
As of right now and yesterday, anybody that needs a test, that's the important thing. And the tests are all perfect. Like the letter was perfect. The transcription was perfect.
None of that is true. The governor of Illinois, one of many state officials who are flat out disputing what the president claims.
I am very frustrated with the federal government. We have not received enough tests. We have tests, we are testing, but we would like to be able to test anybody that shows signs that they need to be tested, and anybody who would like a test.
And by the way, that story playing out in city after city, state after state. Also, Politico is reporting that there is a looming shortage in lab materials, and that is threatening to delay test results. Now, the head of the CDC saying he is not confident that there's an adequate stock. Plus, we are learning more and more about how red tape and disorganization within this administration is delaying the response to this virus. The New York Times, in really a stunning piece, describes the situation in the state of Washington, which is one of the hardest hit areas, as you know. The paper spoke with an infectious disease expert in Seattle who is ahead of this curve. She saw this coming. Dr. Chu had a way to monitor the region for months. She and a team of researchers had been collecting nasal swabs from residents experiencing symptoms. But to repurpose the test for monitoring the coronavirus, they would have needed the support of the state and federal officials. But nearly everywhere the doctor turned, officials, primarily in D.C., repeatedly rejected the idea. So by February 25th, Dr. Chu and her colleagues had it. They couldn't bear to wait any longer. They began performing coronavirus tests without government approval. What came back? It confirmed their worst fear. They quickly had a positive test from a local teenager with no recent travel history. The coronavirus had already established itself on American soil without anybody realizing it. Plus, this could get, as you heard from Dr. Fauci, a whole lot worse before it gets better, and a lot worse than the president up until this point has led us to believe. He's going to be discussing this at 9 o'clock tonight. We're all very curious what new direction he'll take then. But a columnist for the New York Times who I spoke with yesterday gives an idea as to the scope of what we could be looking at. As I described off the top, the European model may not be that far off. She describes a conversation she had with an epidemiologist at Yale. Here's a portion in her piece about that. 35,000 Americans will die from the coronavirus just this year, they believe, which would place an enormous additional burden on hospitals already overtaxed by the flu season. And that estimate is at the low end of the spectrum when it comes to predictions from medical experts in the field. Then there's the economic damage that this virus is also causing. Stocks hammered again today. The Dow diving about another 1,400 points. Now officially, we are in a bear market. What that means is a 20% drop from its high. That ends the 11-year bull market that started just after the financial crisis. Now, that's a major reason why the president, he's talking about a fiscal stimulus plan. Now, Trump also met with Wall Street execs today to discuss ways to deal with the outbreak and how it's impacting markets as well as the broader economy. Both the president and the bankers saying increased lending to small business is one of the key things that's desperately needed. The president also saying he's going to outline his plans for dealing with the virus when he speaks from the Oval tonight at 9 p.m. All right, I want to bring on our first guest, Susan Michaels-Strasser. She is an assistant professor of epidemiology at the Columbia University Medical Center. That number I just gave, and there's projections much more than that at the end of the year, as a frame of reference, that's about the number of people that die from the flu every year. And a common question I get, as if I would know, I'm just a guy on TV, is, well, is it more dangerous than the flu? Is it the same thing? We do know the mortality rates, at least with the information we have with the limited testing, is it is more fatal and it's more easily transmitted, arguably. But how do you answer the question about how dangerous and serious this virus is?
I would say that without causing panic, we need to work with purpose. And this is a new virus. This is a novel virus. We're all still learning. And that's why we need to take this very seriously. People have to read the right information, hear from the experts, learn what they can do for themselves to protect themselves and their families. We're in a new situation. It isn't like it was weeks before. We need to be acting differently. We need to be behaving differently. This is serious. I haven't looked at the modeling that the Yale colleague did, but that number is alarming, and we don't need to panic, but we need to work with purpose and use good public health principles to get ahead of this. We need surveillance, we need point of care testing, and we need to protect our frontline health workers. We need to ensure that nurses and other frontline health workers that are at the bedside caring 24/7 are having the protection that they need, the testing they need, both for their patients but also for themselves, because they're at highest risks. They're seeing people with active symptoms, and without being able to know who is infected and who is not, we are really working in the shadows. We don't have the full picture, and we need as much information as we can get. And that is through surveillance and testing.
To that point, Professor, I want to read a quote. This is from an emergency room physician, and I've heard statements like this from the people on the front lines similar to that. This is from Dr. Phillips. He says, as an emergency physician, my colleagues and I will be on the front lines, just as you described. As an American, emergency agencies will soon likely experience a large and sustained surge of patients. I will likely become infected in the next few months. It's simple math that I've accepted. And I'm pretty familiar with the scene going on in Italy. I have a family that are actually in medicine and doctors on the front lines. And the scenes that we're hearing described, literally, they're asking doctors to come out of retirement in the thousands to help deal with the surge. There's not enough ICU beds. They're literally performing triage at the hospital, depending if people had what pre-existing conditions, etc. To that end, as I understand it, the three biggest concerns the medical community have is supplies, ICU beds, where to put these people, and then the actual medical staff themselves, the doctors and the RNs, etc. How do they navigate if someone gets infected, as that doctor described in the quote? What is the circle of connection that those people have to be quarantined as well? Do we run the risk of running out of people to care for a growing population?
I think it's a good question. It's taking it a bit to the worst case scenario. We're not there yet. We don't want to get there, and we can prevent it. We need to protect our health workers. They are our most important protection at this point. They are the ones at the front lines, triaging, as you said. They're finding out who needs to go into isolation, and that is our best containment measure. It is a scary word, containment or quarantine, but with compassion, we can isolate people, provide them care, and break that chain of infection. We don't want to see what people are talking about. There was an op-ed in the New York Times today in Italy. We can do better. We want to be able to break that chain, and we need the tools to do that. And nurses and doctors and health workers are asking for those tools, and they should get them as quickly and efficiently as possible, because they're there. They're at the front line doing what they need to do, and they will be there. As that doctor said, we want to protect them. We don't want that health worker to be infected because we need them. They're precious. And I have seen this and been part of epidemic situations where we had to respond and bring retired health workers out when the health workers themselves were infected, because they're the first to go in, and retired health workers are there. I'm a nurse. I could be called up to help, and I would willingly do that. And I hope it doesn't come to that, because we want to get this under control. And the way to get it under control is to use good public health principles, and that hasn't happened fast enough. My goal, my desire would be for the United States to have a point of care test that is just like we use for a malaria test or a pregnancy test or a rapid HIV test. Those are simpler to perform, and if we have good reliability and validity of those tests, sensitivity and specificity, then those tests would be one of our best tools in our response, because then we can clearly know what's going on in our community. communities. When we have a cluster like happened in New Rochelle, it's clear. We need to isolate, we need to do something dramatic and close the schools. But right now, everywhere else where there aren't these clusters and it's painfully obvious, we are working in the dark, and we need a quick test to show us. Even the test that is available now takes too long. We need immediate information, and we need to push for that.
I've even in my own personal life run into it where you have, certain kids' schools shut down, other ones not, some trips canceled, other ones not. There doesn't seem to be any uniformity, and I don't want to oversimplify because it's a complicated calculation that you have to do, but doesn't somebody have to make this a little bit more black and white instead of subjective as to who needs to be quarantined when they do? What do we need to restrict? Where can you have crowds? Where can't you? It just seems too much is being left up to private individuals that don't have the knowledge, or even organizations that might have, more than one interest going on at the same time.
Exactly, and that unknown, that subjectivity, that lack of clarity causes panic, and that's what we see. That's a natural human response. We're afraid. We want answers. We want leaders to give us clear and definitive answers. Even if they don't have all the information at their fingertips, people need clear guidance. That's why we have leaders, to make those tough calls when we don't have all the information at the table. And we're not getting those to the extent that we need. New York State and New York City Department of Health are doing it, and I'm seeing that from our leadership here, and really sending out clear and consistent messages. But subjectivity really fuels panic, and someone needs to present to us clear guidelines. What do you do, when, where, and how? And we don't have that right now for school districts. We do know that many colleges and universities, my university, Columbia University, has been closed, and I believe that was the right thing to do. We have lots of students in closed classrooms, and we can do the work and teach virtually. It's smart to do that. It's wise to do that. And so we are moving forward with that. We had 2 days of canceled classes and then moving to virtual classes, at least for now and after spring break for about a week, and to allow us to get a better understanding of what is out there. Without having surveillance, the school districts that aren't closed really don't know what is out there. Obviously, we don't have large-scale clusters or community spread yet, but we don't know. So those unknowns do make people worry and feel very uneasy. And if there were clear guidelines, I think that would help all of us.
One last thing, you talked about leadership, and one thing I have taken is, it's not Monday morning quarterbacking. It's critical right now to see when we make a mistake to identify it so we don't keep repeating it. And I'm sure you saw it, that recounting of what happened in Seattle with, amazing people who were trying to get ahead of this, who were helping, you would think, the federal government here in terms of identifying something on the front lines before it metastasized into something that we now see. And not only were they not getting help, they were getting resistance. And I've spent a lot of time on the show with the misinformation that has come out of the White House in the beginning, and finally they seemingly have found religion on what we're dealing with now. But we're going to look back, aren't we, Professor, at the month, if not months, that we missed an opportunity to not only prepare for this, but also to prepare the American public for this. And instead, we spoke at cross purposes. We're going to look back and regret how December, particularly January, were missed opportunities.
I do think there were missed opportunities. I think we have to eliminate those. From today forward, we need to be as aggressive and as conservative as possible and get out and help people. I'm a pediatric nurse practitioner, and one of the things I learned was always trust a mother's or father's instinct about their child. If they're worried, you be worried. They know their children. And if doctors were to call me from a community raising alarm bells, that needs to be listened to. They know their community. They know what they normally see. And if it's out of the ordinary, we need, out of an abundance of caution, to take that seriously. And from here forward, that is what has to happen to get this under control. We know from history, we know from the influenza of 1918, aggressive measures made a difference. It won't last forever, but people shouldn't think it's just the flu and it's just another thing that we're going to get through in a couple weeks. We really need to take this seriously and work with purpose.
Professor Strasser, thank you very much. I really appreciate the time today.
You're welcome. Thank you.
All right, when we come back, we are going to bring in our legal panel, some big stories in the news, including one relevant to the topic we just discussed, whether or not people who violate quarantines could wind up in trouble with the law. We'll be right back.